I'm Scott Banks, and my first time that I needed care from Dr. Beachman was my knee was really hurting me. I'm pretty active, so I do lots of things, and it just was this nagging pain. I was just like, there's something going on. I was talking to one of my colleagues and trying to figure out who I needed to go to, and she mentioned Dr. Beachman and that he has done great work, and all the patients that she had met with and knew about, that I should try him.
Well, when I first saw Scott, he wasn't doing too well. He was kind of limping and having a lot of pain in the knee. And Scott is a very active guy. I know you do a lot of running and
biking.
And so we kind of went over some of his stuff in the office, and he had some tearing in the cartilage in his knee, and we talked about what his options were, and we kind of decided that surgery would be kind of the best option to kind of get him back to his previous activity level. Now, that's not the case for everybody who comes in my office. Not everyone needs surgery, for their problem, but he was someone who I thought would benefit from it, and so we kind of went over the benefits and risk of everything, and we decided to kind of go forward.
This is my first surgery I've ever had in my life. So to go, for as long as I've gone in my life and there after surgery, I was just like, I wasn't that nervous though. Dr. Beachman totally had me calm, knowing like, hey, this is a kind of a slam dunk surgery. It's not gonna be that complicated. He told me about the time that it would take and what the recovery might look like. The nurses, the caregivers explain the process. I think that's really important to do to a patient, is let them know what's coming ahead, because you don't always know that. And Dr. Beachman and the staff did a great job of that, of letting me know, hey, this is what's coming up. This is what it's gonna look like. Do you have any questions?
So Scott had an arthroscopic procedure. So basically it doesn't involve any kind of big incisions or large kind of cuts in the skin. It's poke holes in the knee. And basically we make a couple of poke holes. He had a tear in the cartilage in his knee that was flapping around in the knee and causing inflammation and pain in the knee. We take some small instruments, we repair the parts of the cartilage that we can repair, and we kind of shave the parts out that are kind of causing pain in the joint. We also kind of clean out any loose bodies or other inflammation that's in the knee. But the real fun starts after the surgery, when you gotta get into the therapy and the therapists kind of do their magic. And Scott was great about doing the exercises and the work that are required for this kind of procedure to kind of be successful.
I started doing physical therapy, so Dr. Beachman wrote an order for physical therapy. They did an evaluation on me. They really explained to me about the different muscles around my knee and trying to strengthen those to get them back so that my knee would be probably, I would say, stronger than it was before.
The hospital's in a unique position in our society where we're asked to kind of be a business, but at the same time kind of serve a greater good. Philanthropy keeps some of our services available to everybody, especially some of the imaging and whatever future technologies that we may need that we are trying to get at the hospital. It's vital to the hospital staying open and serving everyone in the community.
I'm Scott Banks. I'm a grateful patient here at Mercy Medical Center, Merced.